Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Hello. Thanks for listening into this episode of the TechLink Health Podcast. This episode focuses on the emerging biocomputing revolution and the technologies that are powering the future, with a particular focus on bio-integrated technologies and devices. This episode's guest is Dr. Aadeel Akhtar, CEO and founder of Bionics, a company redefining what it means to be human through bio-integrated technologies. Their first product, the Ability Hand, is an advanced bionic hand that is accessible for people with upper limb amputations. The Bionics mission is not just about what users can achieve, it's beyond that. It's strongly tied to creating affordable, accessible, and unique bionic abilities that surpass human capabilities, providing individuals with superior technology and redefining performance. During his work with Bionics, Aadeel has been featured in MIT's 35 Innovators Under 35. So without further delay, let's join host Justine Reese in welcoming Aadeel to the podcast.
Well, it's quite obvious that Aadeel has a passion for bio-integrative technologies and innovating in this space. We're really looking forward to hearing your perspectives. Welcome to the podcast, and thank you so much for joining us today.
Thank you for having me. I'm excited to be here.
Yes, and you guys may not see him, but he's holding a hand. I'm just saying that. I'm just saying he's holding a hand. So to start, give our listeners a little more background, right? Take a moment, introduce yourself in your own words. Tell us about this journey into this bio-integrated technology space.
Yeah, so as you know, I'm Dr. Aadeel Akhtar. I'm the CEO and founder of Bionics, and we develop, as we mentioned before, bionic limbs, advanced bionic limbs that are affordable and accessible for everyone. And this whole journey for me started actually when I was 7 years old. I was born in Chicago in the suburbs there, and my parents are from Pakistan. And I was visiting when I was 7 in Pakistan. And it's the first time I met someone with a limb difference. And she was my age, missing her right leg and using a tree branch as a crutch. And that's what inspired me to want to go into this field and develop advanced bionic limbs that were affordable and accessible.
Wow. Oh, that's so cool. And did you have a friendship with this person, or was this just like a passing thing that just imprinted on you somehow?
It was just a passing thing. We were just out shopping at the local markets, and and she was on the streets. And so, I didn't know her personally, but it definitely left an impression.
Wow. All right. Well, that is an inspiration that carried you from childhood. Did you have this as the mission the entire time you were going through all your studies? Or was it something like you might have gone into something related, or you always knew you wanted to literally get into bio-integrated technology?
Yeah, so, bionics and prosthetics in particular were something that I'd always wanted to get into, but what was more flexible was the best way to do it. And so I did my undergrad at Loyola University of Chicago, and I was pre-med and studying biology. And it was my sophomore year of undergrad that I took my first computer science class, and I absolutely loved it. I loved everything about coding and engineering and building my own things. And now I realized that if I became a straight up MD, I wouldn't get to do the cool things that I was learning in my engineering courses and the CS courses. And so I wanted to figure out a way to combine the two. And right down the street in downtown Chicago, there's a hospital. It used to be called the Rehabilitation Institute of Chicago. It's now known as the Shirley Ryan Ability Lab. It's the #1 rehabilitation hospital in the US for the last 31 or 32 years. And they had made these breakthroughs in these muscle powered bionic limbs. And it was this perfect combination of physical medicine, rehab, neurology on the medical side, as well as like computer engineering, mechanical engineering, electrical engineering, programming. And I was like, this is exactly what I want to get into. And so I ended up getting a master's in computer science. I taught at Loyola for a couple of years before going down to the University of Illinois for the MD PhD program there. And as you mentioned, I got another master's in electrical and computer engineering and the PhD in neuroscience. And technically, I finished the first year of medical school, but building bionic limbs was more fun. So I ended up leaving.
Oh, wow. And, we were joking around earlier, and did you ever see the $6 million man or the $6 million woman when you were a kid or a young adult? Because not that you're, you might be too young for any of this.
It was before my time, but we get compared to it so often that I've definitely seen clips.
I'm sure, there's a relevance in terms of just what could be done. And it's so fascinating. But I love that story. And obviously, Psionic is focused on improving the health and wellness of those with prosthetics. But tell us more about the full spectrum journey and how the many players in this healthcare sector have or will contribute in the future. I mean, how does it impact and appeal to the broader industry?
Yeah. And so this is interesting, right? I mean, and to go a little bit more into like, the journey of how we built these devices from scratch, right? While I was a graduate student at the University of Illinois, I got the chance to go down to Ecuador and work with a nonprofit organization there called the Range of Motion Project. And their whole mission is to provide prosthetics to those who can't afford them, in the US, Guatemala, and Ecuador primarily. And when we went down there, we were working with a man who had lost his left hand 35 years prior due to machine gun fire from a helicopter. He was in the Ecuadorian army. And this is a much longer story of, 2 weeks of all-nighters trying to get this hand to work and, preparing for this international news media event. But at the end of the day, we were able to get our patient, hold on, to make a pinch with his left hand for the first time in 35 years. And in front of these news stations, he literally said that he felt as though a part of him had come back. And that's when we realized that we couldn't just leave this as like a university project or a journal paper. We needed everyone to feel the exact same way that Juan did. And in order to do that, we had to commercialize the technology. And historically, a lot of these bionic devices have just been relegated to research and academics. And so you had a lot of grant funding in the past, like from DARPA, for example, that funded university researchers and some companies to build, advanced bionic limbs. And so for us to want to be able to commercialize that, that was a pretty big step because, we're no longer in the safety net of academia where the goal is to publish research papers, but the goal now is to actually get a working device that's FDA registered, that's on people and they're using it on a daily basis and they're going to be putting it through the ringer, which is much, much more difficult in that setting. And there's many more stakeholders, as you were mentioning too, right? So we've got to have the prosthetists involved, right? We've got to have the physical medicine rehab doctors involved. We've got to have the surgeons who did the amputation involved. We have to have patients, right? And then the insurance companies as well, who end up billing for these devices. So there's all these different layers of the medical field that are all coming together to make this happen for our patients.
It's so fascinating. And I'm so curious at how you, tested this and who can be a candidate and who can't be, for this. And do you take it off and put it back on? And what makes it work? I always ask like the person who knows nothing about Bionics is asking this question. Like, I want to know, how does my brain signal to move a hand that's not mine and make it feel like mine? What happens?
Yeah, absolutely. And so when we came back to the US from the Ecuador trip, we started working with a retired US Army Sergeant, Garrett Anderson, and he lost his left hand in Iraq in 2005 due to a roadside bomb. And he uses a hook on a daily basis, right? And that's technology that hasn't changed since like this little war era of the United States. And so when we first started making these bionic limbs, right, it was fully 3D printed. These hands were like 3 times the size of an average adult human hand, and wires go everywhere, plumbed to breadboards, the wall, like you name it, right? And so with Sergeant Anderson, like we would hook up muscle sensors to him, right? And then like they would go to this giant breadboard, and then they would go to like this hand that was sitting on the table, and we would get him to control it, right? And we kept iterating on those devices so that we could get to a point where instead of it being on a table, we could then attach it to like his residual limb. And so the way it works for him is that he's got a little bit of his arm left right below his elbow. So he's got a little bit of his forearm left. And a prosthetist will actually make a mold of his residual limb, and it's kind of like a cast. And then a socket that it has the muscle sensors embedded in it, along with the electronics like the batteries, the charger, etc. And then her hand attaches to that socket. And when he tries to move his muscles, then we can read those muscle signals and use that to actually open and close the hand, change grips, and do all sorts of different activities. And then at night, you can take the arm off because it just holds on via suction and charge it. And it's USB-C charging. And you can actually charge your phone from your arm too. It's somewhere you can plug in your phone, you can plug in your arm. It recharges from 0 to 100%.
That is crazy. And wow, that's wonderful. That's very incredible. So let's talk about the future and how biointegrated technologies will continue to evolve and integrate with brain computer interfaces, or otherwise BCI. In fact, one of TechLink Health's aspirations is to help make use of some of the data and practical application of Internet of Health Things technologies, which starts to emerge with biointegrated technologies. So we have to talk about this. Elon Musk's Neuralink, along with other BCIs, focused on residual touch signals, among other use cases. So give us your perspective on that topic and where are we going, Aadeel?
Yeah. Yeah. And so with our bionic ability hand, right, we made it so that it would work with clinically available systems now, and as well as when a lot of this future technological developments come out. And for example, this is the only hand on the market to give users touch feedback, right? So in each one of the fingers, we've got 6 touch sensors that are in it. So one on the fingertip, the finger pad, 2 on the lateral side, 2 on the medial side of the finger. And when you touch it, right now, users will feel a vibration in their socket, right? So they'll let you know when you've come into contact with an object, when you've let go of the object, and how hard you touch that object. It's basically like a notification system that just vibrates, kind of like your phone, right? But that being said, we can actually stream all of the pressure sensor, all of the touch sensor data over either Bluetooth or like a USB connection or whatever wired connection that you want. And with that, we're actually collaborating with researchers such as Nerves Incorporated that are doing peripheral nerve implants, as well as like University of Chicago who are doing brain implants. And the idea there is that with touch feedback, you could actually stimulate your peripheral nerves or the neurons in your brain and make it feel like it's actually, that sensation is actually coming from your hand that's no longer there. So that when you touch the fingertip on the prosthetic, on the bionic index finger, then it'll feel like it's actually coming from your index finger. And that's the direction that we're heading with all this technology, especially with these implanted devices. So this touch feedback aspect, also the motor control aspect, where instead of just controlling like grips, where you do like a power grip or like a key grip or a pinch, for example, you would be able to accurately control individual fingers. So we're talking about the ability to potentially type on a keyboard again or play piano again. And so those are kind of those exciting endeavors that we're heading towards with these newer technologies.
But right now, do the 4 fingers and thumb sort of all work like one unit at this point?
So the hand is capable of moving each finger individually. So right now, the way it works though is they're pre-programmed grips, right? So the grip that we're doing is literally called finger wave, where each of one of the fingers moves individually. Or it'll be like a grip called a power grip, where it's like a fist, right? Or a key grip, where it's like where your thumb is going over your index finger in a closed grip, and that way you can hold things like a key or a credit card or a paper or a plate, for example. And instead of doing those grips, those pre-programmed grips, what these implanted electrodes will enable you to do is actually do this fine individual finger control the same way that, you control a natural hand, where you're not actually thinking about making a grip, but you're actually moving each one of your individual fingers to that shape, and it's making that grip overall.
Wow. What has been the reaction when someone feels that hand again? What kind of reactions have you gotten from people? And do you get to sort of see that? How often do you get to see that?
So fortunately, one of the biggest things that's important to us is having a close relationship with our users. And so, for example, like yesterday, we just met a potential patient for the first time, and they came and visited our offices. And the patient had very recent amputation of his left hand. And within minutes, he was able to use his muscles to control a device. And for him to have that kind of experience where he was able to just like walk in and then like within minutes get set up and start controlling his device with his muscles, he was very hopeful for being able to adapt to the future that he wasn't necessarily expecting of having.
Wow. I can imagine. Yeah, what a great bridge to get from off the operating table and into basically sort of a rehab situation and have your hand motion again. That's amazing. And then, I know one aspiration is for psionic devices to be fully integrated with human neuromuscular system. I guess that's sort of what you were just talking about, but talk a little more about the journey of getting from here to there and what are some of your challenges in doing that? And do you work alongside the doctors doing the amputations? How much better is that for the journey or the bridge to get use of my hand back through this technology?
Yeah, absolutely. And so traditionally, the way these prosthetics work now, as I was mentioning, you get a socket that's made, right, that you slip your residual limb into, right? And there's a lot of challenges with those sockets, right? I mean, imagine like wearing a shoe for your arm, essentially, right? Things are going to shift around it. It's going to get hot. It's going to get uncomfortable. You sweat, and you can get electrical interference from things that are messing with the muscle sensors and all sorts of things that are unnatural, right, for your limb. And the other thing is that because these devices aren't necessarily attached directly to your bones, but a natural hand would be attached directly to your bones, they feel a lot heavier because they're not loaded in the same way that a natural hand would be. So we just moved to San Diego, California. And one of the big reasons that we moved down here was to work with the military hospital out here, as well as the orthopedic surgeons at UCSD, working on something called osseointegration, where instead of using a socket that you would shove your arm into, you would directly connect the bionic hand to your bone so that you'd have a titanium implant that goes in your bone and then actually comes out of your skin, and then the hand would attach to your bones directly. And that way, it eliminates all these things like having to wear a shoe or a socket over your arm, and a more natural interface that's directly connected to your bones as limbs typically are. And so that was one of the reasons why we moved down here, as well as integrating the implanted electrodes through those titanium implants to your bones as well. And that's kind of like the best of both worlds, right? So we've connected your nerves to it. We've connected your bones to it. One of the other surgeries that we're looking into is actually connecting your tendons to an artificial tendon system that you can use to control your fingers as well. So we're at the forefront of all this research that's going on. And it's a really exciting time to be in this field.
I can just imagine. The website's great, by the way, psionic.io, spelled Psyonic. And there's videos, content on here. There's amazing photos of the hand. And there's even something that talks about the fingerprint, which you mentioned briefly, but talk a little bit about that.
Yeah, so we have these highly sensitive touch sensors where the bionic hand on the market to give users what we call multi-touch sensory feedback, where you can actually feel it from different parts of the hand. And we can actually feel a weight down to 10 grams, which is super, super light, all the way to like 10 kilograms of weight being placed on these sensors with a resolution of like 1 gram. So it's like super sensitive and a high dynamic range. So it can really detect like all the different things that you might do on a daily basis. And for our users to be able to then feel that haptic feedback, to know and have the confidence that they're grabbing an object.
Wow, that's very incredible. Well, this was super informative and exciting. And any final advice for those that want to learn more about bio-integrated technology space? There's also, I know there's a place to look into investing on your website, and there's something about something you're launching soon. I don't know if you want to tell us whatever you can reveal about that now.
Yeah, absolutely. And so for investors who are interested in investing in Psionic, they will soon have an opportunity. So yeah, sign up on our website if you guys are interested and follow us along, because it's going to be a really exciting future coming along.
Super cool. And what's the best way to stay connected to your work and all the updates at Psionic? LinkedIn, of course, we can go to the website. Any other places to look for you guys?
Yeah, so we are on basically every social media platform. So LinkedIn, Facebook, Instagram, TikTok.
Great. Well, thank you so much, Aadeel. It was great talking to you. This is very, very cool. Thanks for coming to the TechLink Health Podcast today.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.